MLS class of Miss Campbell's microbiology class. My name is Megan Lewis, and today I'm going to present to you a case study on E. coli and Entercoccus faecalis. So let's get started. So as I present this case study to you, I'm going to present the patient with their signs and symptoms, the workup that we done, and how the laboratory goes about identifying these two organisms. So we have a 34-year-old male who is a physician's assistant come into our ER complaining of severe abdominal pain, a temperature of 100.4, and complaining of fever and chills. He has previously been diagnosed with diverticulosis and started Levaquin the week before, thinking that was what was coming about. So the physician on call orders a CBC, a comp, a UA, and a CT. Below and right here are the abnormal values that are added to the list. We have a white count of 16.0, a red count of 3.6, a hemoglobin of 11, a hematocrit of 33, a platelet count of 683. In his urine, he showed blood, leukocytes, and protein. And on his CT, he showed a perforated diverticulosis and inflammatory change around the sigmoid tissue. After review of the results, the patient was sent upstairs and put into surgery to fix the issues. After a few days, the patient complained of abdominal pain again and ended up having an abdominal abscess. The physician obtained a sterile aspirate of the fluid, and it was sent to the laboratory for further analysis. The following media was set up: a TSA, a MAC, a chocolate, and a gram stain was done. On the TSA plates, we have a beta hemolytic growing on the top left and on the top right, and on the top left we have a non-hemolytic growing. On the gram stain on the top, we have a gram-negative organism, and on the bottom we have a gram-positive cocci. So, initially on the gram-positive that we're going to work at first, initially you do a catalase to rule out the staph species, and of course this specimen was a gram-negative, and I put a star by that. So the next testing that would be needed would be a bioasculin, which it was positive, and you can see that by the black because it is fermenting the bioasculin. And on the 6.5, he also showed on it. So there are the positive and negatives for you to see there. And then the test that you would need to distinguish it from strep bovis would be the PYR test would be positive for the Entercoccus, and if it was negative, it would have linked it to strep bovis. So the next organism that we're going to talk about would be the gram-negative, the second organism that showed up as a non-hemolytic. And as you can see here, it ferments, and it has showed up a nice pretty pink and rough colonies. And then here are the few tasting that you would do. The TSI, it would be an A over an A, and I starred that right there to show it can be completely yellow. And then on the indole test, a positive, which it was, would have the purple on the very top, and a negative would prove that it was a Klebsiella. So we done that testing. And then for our next testing, we would have the methanol red, the citrate, and the urease. The urease and the citrate for this organism is negative, and the methanol red would be positive. And then I just kind of threw in some slides to let you guys know what it would look like, E. coli, if you were on the HE auger or on the EMB auger. On the HE, because it ferments, it turns it a nice pretty salmon pink or orange color. And with the EMB auger, you have a nice pretty green sheen color. So that's what they would have seen. So after a few days of isolation and septability done with the disc, this is his results that come up. And of course, for E. coli, we have meropenem, which was susceptible at 0.25, and then for the Entercoccus faecalis, we done the vancomycin. We couldn't do the ampicillin because it was susceptible on the Entercoccus faecalis, but on the E. coli, it was considered resistant. So this patient was put on 2 separate antibiotics for the duration of his stay in the hospital. He was put on vancomycin and meropenem for about 3 days. Just so y'all are aware, just because E. coli and Entercoccus is part of the normal flora of the GI tract, if it grows enough on the plate, it needs to be worked up because it is a very serious organism. So it was worked up, and we ended up with Entercoccus faecalis and E. coli. So after a few days, the patient has been discharged home and is feeling well.